How can I afford osteoarthritis surgery and rehabilitation costs? If you're facing joint pain that just won't go away and thinking about surgery, you might wonder how to handle the costs. Surgery and rehab can seem expensive, but there are ways to make it manageable. First, most health insurance plans, including Medicare and private insurers, usually cover joint replacement surgeries if your doctor says it's medically necessary. This means the insurance will often pay for the surgery itself, hospital stay, surgeon fees, anesthesia, and some physical therapy. For example, Medicare covers inpatient surgery under Part A and outpatient services like physical therapy under Part B after you meet your deductible. Medicare often pays most of the costs, but you might still owe a co-payment or co-insurance. Private insurance works similarly, but your out-of-pocket costs depend on your plan's deductible, co-pay, and co-insurance. Always check if your surgeon and hospital are in network to avoid extra charges. Even with insurance, you might have to pay some expenses out of pocket. These can include deductibles, co-pays for doctor visits or therapy, and costs for medications or equipment not fully covered. The average cost of a knee replacement in the United States ranges from about $14,000 to $49,000, but insurance usually covers most of it. Your actual costs depend on your insurance, the hospital, and how complex your surgery is. To plan ahead, review your insurance policy carefully and contact your provider or Medicare for an estimate. Ask your surgeon's office if they offer payment plans or financial assistance programs. Many hospitals have options or discounts based on income. Consider using health savings accounts or flexible spending accounts if you have them. These accounts let you pay for medical expenses with pre-tax dollars. You can also look into community resources or nonprofit groups that might offer grants or help with costs. If you do not have insurance, talk to your healthcare provider about charity care programs or sliding scale fees based on what you can pay. After surgery, rehab is essential for recovery. Insurance often covers a set number of physical therapy sessions, but there may be limits. If you need ongoing therapy, check if additional sessions are covered or if you will need to pay out of pocket. Follow-up visits are usually covered for a certain period after surgery, but later visits might be considered regular doctor appointments with co-pays. Long-term, joint replacements can last many years, but they may need revision surgery if they wear out or become loose. Most insurance plans cover revision surgery if it's medically necessary, but confirm this with your provider. Remember, surgery and rehab are generally covered when deemed necessary, but you might still have some costs. Always verify what your insurance covers, including which providers are in network. Explore payment plans, financial assistance, and community help if you're worried about costs. Rehab is a vital part of recovery and is usually covered, but there may be limits on sessions. Regular follow-up visits help ensure your new joint stays healthy and functions well long-term. By understanding your insurance benefits and planning ahead, you can make the process of getting osteoarthritis surgery and rehab more affordable. If you have questions, your healthcare provider and insurance company are there to guide you through the details.